Good morning, everybody. Welcome to our session. My name is Meryn. I'm the founder of the Future Health Lab. The Future Health Lab was founded to generate a space for innovation and impact in the Austrian health system. I would say quite a challenge for those who know the Austrian health system. Here on my side are two people who really from the very beginning supported this. This is Katharina and Peter. We will come to that later on. And we also made a further move because we have now a joint venture with the Impact Hub. So we are here at this for the third consecutive year and decided that this would be what we call in Vienna a mélange that might fit very well if we combine the impact with the innovation, because that's what it needs in challenging times. We have 60 minutes and we decided not to prepare any slides because we thought that what we want is a vivid discussion. We have an extraordinary panel here, people who represent the best in their field, and probably the 60 minutes will be far too short for us, but nevertheless, I also would like to involve you. So for the last 10 minutes, I would invite you for questions, but also for comments, for whatever you think is suitable and would enlarge our discussion and have an impact on that. Europe's healthcare system is under pressure. This is not only the Austrian, but I would even say it's not only Europe. It's in the Western world definitely quite a challenge. And what it requires is, and that is probably the most difficult task, a systematic change. The system has to change. The way we are running our systems, we probably can't not afford it. And what we also see that the patients are not happy, and we want to move on from patients to prevention and to include artificial intelligence and other things. So there's definitely a time for a big change. Any systematic change depends on shared vision, strategic investment, and also willingness to do that. And this is why we have such a diverse panel up here, representing different organizations and representing different ideas in the field of medicine, because I definitely believe we have to get out of the box. Until now, whoever we represent, we still have box thinking wherever we are, and we do not appreciate and accept that we have to leave those boxes. And we would like now to dive into those urgent questions: how to create the future of our health, I mean still the European and the Austrian health system, because this is an international meeting, conference with a lot of people who share their different experiences. And very often I envy those of you who come from Scandinavia, where I do see quite a progress and some best practice and role models for all of us. We tend to travel to Norway, to Sweden, to Denmark, to the Netherlands, say, wow, come home back and do nothing. So let us believe that today is a starting point. And I invited all of the speakers here up on the panel to give us like a 3 to 5 minutes input from their perspective, and maybe just one sentence who you are and what your position is and why you did choose this as your first statement. May I start with you, Katharina?
Thank you, Siegfried. Yeah, hi. I'm really happy to be with you. My name is Katharina Reich. I'm Chief Medical Officer in Austria for the Federal Ministry of Health, and I'm responsible for public health and healthcare system. And we think our system is ready to start for innovations to integrate new systems. We have a good healthcare system, But let's face it, there are many challenges, and we are here to solve the problems. Thank you.
That was 1 minute. The statement, the statement. But let's make the introduction and then the statement.
I just thought it's only the introduction, so I'm sorry.
Introduce yourself. Yeah, fine.
Good morning, everyone. My name is Ulrike Appenberger. I'm chair of the Department of Radiology and Nuclear Medicine at the Medical University of Vienna, so I'm a radiologist by training.
Thank you. I'm happy to be with you. My name is McDonald. I'm the leader of the Austrian health insurance, of the social health insurance. I used to work in politics, but also in the private sector, the biggest healthcare company of the world, Johnson & Johnson MedTech, and now back in the public sector.
Good morning, my name is Elma. I'm really happy to be here. I'm a postdoc fellow at the Complexity Science Hub at the Medical University. By training, I'm an electrical engineer, however, I just fall in love with data science and AI.
Good morning, everyone. My name is Meier. I'm the CEO of the Healthcare Center here at Vienna, Sonnwendviertel. Formerly, I co-founded Siegfried, an AI company. When I say AI, I'm trying to define this a little bit more. An AI company that focuses on image diagnosis, support, decision support, and radiology and orthopedics. Happy to be here.
Once again, now it's
thank
your...
you once again.
4 minutes left.
4 minutes left. Hurry up.
No, 5 minutes.
Let's face it. Artificial intelligence holds transformative potential for medicine. We already know that. It's for improving diagnostics, personalizing treatments, and streamlining our healthcare systems. And here in Austria, we are really proud of our innovative healthcare system, but let's face it, we must ensure that AI aligns with our core values, trust, safety, and equity. So what's now going on with AI in the Austrian healthcare system? We have some progress and we have some challenges. We have made significant steps under initiatives like ELGA 2.0 and our Digital Health Transformation Fund, integrating AI into areas like radiology and predictive analytics and hospital resource management. However, critical challenges remain for us. We have bias and regional disparities, like AI models trained in primarily urban centers like Vienna may not account for the unique needs in our rural regions. We have regulatory alignments, like while Austria's Medical Devices Act, like our Medizinproduktegesetz and GDPR provide a strong foundation, AI-specific frameworks are needed to address dynamic risks. To the point of interoperability, our AI tools must seamlessly integrate with our ELGA systems, our electronic healthcare record system, and without compromising our data security or our patient consent system. Our goal is clear: AI must enhance and not undermine the Austrian Healthcare Quality Act for sure. And the Ministry of Health is taking decisive action. The Austrian AI in Healthcare Act is still under development, will establish mandatory transparency, auditability, and post-market surveillance for AI tools aligned with the EU AI Act. The FAIR AI initiative also is ensuring AI training datasets should reflect Austria's demographic and geographic diversity, with an oversight from our Austrian Public Health Institute, Gesundheit Österreich GmbH. And we have also pilot projects with public-private partnership models. For example, we have an AI rehab project in Lower Austria. It uses AI for personalized rehabilitation while adhering to the Data Protection Act, DSGVO. Through the Digital Health Austria, we are creating a unified ecosystem where innovation meets accountability. So, closing remarks. Austria. I'm sorry. The Austrian healthcare system is built on trust, precision, and solidarity. As we embrace AI, let's uphold these values through strong policies, inclusive design, and solid accountability. Together we can ensure that AI not only advances medicine, but also strengthens the very fabric of our healthcare system. Thank you for your attention.
Thank you so much, Katharina. Just one comment, and then I will change the program. I think we will go through all 5 of you, and then I will open up the discussion for all of you, and then come back to questions that I have on mine. The only thing I would like as a critical comment, like at this point, make when you say, and unfortunately it's the truth, that we now work on the Austrian AI Act, and if we see those 1.5 pages for health,
Yes.
you wonder that everybody was surprised that we have AI around and that the AI Act is not ready since 2 or 3 years. That's the only comment.
Yes.
Not to be cynical.
It's the right comment. Really.
I'm not cynical. It's rather it's hurting.
Yeah.
Peter, may I invite you, because you represent, and maybe not everybody is familiar here in this room, the Österreichische Gesundheitskasse, with an unbelievable amount of people. You represent 7.6 million out of 9 million Austrians. And I think you have more power than you believe. This is the invitation for you.
I know.
And maybe you will comment also, please.
On the power thing, maybe I comment later. But let me stress artificial intelligence maybe from a different angle. I think the key issue of artificial intelligence is its acceptance. And acceptance, I think, is a topic which is not stressed that much in the technical sense, because we're always talking about the technology. But I think from our perspective, or from my perspective as a leader of the social insurance, this is a topic which should be stressed more often. So let me begin with something fundamental. The social health insurance in Austria is the backbone of our social system, of our healthcare system. But not only, because it is also the backbone of our healthy economic system. And also that is not easy to understand for all, that this is the main part also why Austrian business is successful as it is. But we are also in a situation where we have to ensure the high quality care to make it accessible for all the people, regardless of their income, of their status, and of their region. That's not typical in all of the places in the world, but it is in Austria. And our role is not only to preserve what works, it is also to prepare the grounds for that what comes. And that's the topic what we are discussing now. And we do not want only to be a passive observer on that topic, we want to be a strategic player, or at least that should be the goal, to come into that position. We've always been proud in Austria of the openness to medical innovation, and we were always pioneering treatments and integrated care systems. And the progress is for us typically, and it's part of our DNA, that this is very important. But still, there is a lot of regulation that can slow us down, but also the complexity of the system in healthcare is slowing us down, and we are part of that complexity, and I think that's a topic we have to face. And now with a system where the health insurance is fused into a 7.6 million client organization, should make it easier for us to take this responsibility to bring artificial intelligence more also in our part of the medical system, in the primary healthcare, but also in the healthcare of doctors, not only into the clinics, but also into these directions. And as you know, that high personalized advanced use of health in prevention. That's the future, and that's an enormous potential, but it's also driven by enormous expectations, but it's also driven by enormous concerns. And I think we have to address that more, not only in these discussions, but address that more in the population. What is the benefits of artificial intelligence? What is the benefits of digitalization? And let us not only speak about the technology alone, because the critical point of the innovation is that it only will succeed through acceptance in the population. And the people must trust that these tools are working for them and not only working on them. And I think that's exactly where a social insurance company, which is a public organization, can have a decisive role where we have to build on, obviously, but I think it's an important one. Oh, I see, Freddie. I see.
Knowing you were a politician, I thought I'd give you
So trying to go further on this. So here's our position. Social insurance is not a barrier to innovation, even as we know that we are part of a very complex system, but it's the foundation of it, and we want to be an enabler and a platform for artificial intelligence, and that's what we're working on.
4 seconds over. Right to the point. Thank you so much. So we heard first Katharina from the point of she's Chief Medical Officer of the Republic of Austria from the Health Ministerium. We heard Peter, the biggest insurance company, social insurance company in Austria, representing 7.6 million. And now I invite you, Ulrike, as an academic. You are at the Medical University of Vienna, but you didn't mention that you're coming from Germany, and you did many really spectacular pilot programs in artificial intelligence. And you are still a consultant for the Germans, for the Republic of Germany in AI in medicine. And we hope you will consult us now from both experiences.
Thank you so much for the kind introduction. I would like to make 3 brief remarks from the perspective of a physician and a researcher. Remark number 1 is, and that's the European perspective, and I would say even more the German and the Austrian perspective compared to other countries within Europe. We really are standing at crossroads, and our societies need to make a decision how to drive digitalization in the healthcare system and implementing AI at a larger scale than we do today. Compared to other areas in the world, we are really losing touch. I don't want to be too negative, but one can maybe also say that we've already lost touch to some extent. And we were discussing before that meeting that without digitalization, we cannot implement AI into our daily clinical routine. We can't even train our models without having our data digitalized. So that's the first step before even talking about any fancy implementation of AI into clinical use and making it available to serve our patients on a daily clinical basis. Statement number 2 is a statement of a researcher, and I would like to take more the global perspective. This is not something that's only sort of a challenge we have to solve within Europe. It's a global challenge we have, because it's not that easy to really train and develop meaningful AI tools that can be implemented at a large scale. And I see, and I would like to state it or phrase it that way, that we have to close the adoption gap. And I would like to reference on a New England Journal of Medicine publication published by the Harvard Department of Economics back in November 2023. So I would really recommend who's interested in it to read it. and Shani is the lead author, and he told us that it's an analysis of the top 10 hospitals within the US, including Stanford and Mayo clinics and so on. And what they figured out in their publication is that they are pretty good, and we are talking about the US. They are very good at implementing and training AI models, but they are still in the developmental and pilot phase. They didn't get their models to a broader implementation rate, if you want. And statement number 3 is the statement of a physician. We are talking a lot about digital health and AI, that we needed to compensate for the shortage of healthcare professionals. I mean, that's obvious. It's not a weird, blurred vision of the future. We already have a shortage of healthcare professionals. It's a fact and reality. And our health economic system is also facing cost pressure. But what you already mentioned is, and I think this should be the main trigger why we focus on digital health and AI, it's to really make precision medicine happen. And there's still a way to go. I mean, the buzzword precision medicine is out there in the community, in the medical community, for more than 12 years. And I brought you some figures here from the United States, a publication by Eric Topol. The healthcare expenditure in the US rose per person from $550 per year in 97 up to $11,000 per year by 2016 or 2017, something like that. The number of healthcare jobs rose from 4 million to 16 million. It's the number 1 within the US economy. So my expectation would be, given the numbers, that we see a significant increase in life expectancy, but we don't. And if you read his books, it's not only true for the US, but also for European countries. And that should be our utmost and first motivation to work on digital health and AI. Thank you.
Thank you so much. Very impressive data. We need that then to again realize, because otherwise we start talking, and we think this has no economic impact, and it has no social impact, and it has no impact on the health. And we did not talk about prevention. You spoke about disease and those numbers. But you mentioned it, everything is about data. This is at the bottom of your heart. Your whole experience, your education and everything, and I know this is your topic, but this is probably one of the most important topics to be within the idea of framing it, making sure that it happens, and to really use the options and whatever we have. So I invite you with your opening statement as somebody who's really into the data. Take this one.
Thank you. So for past 6 years, I'm working with medical data collected in Austria. Thanks to the Gesundheit, also OGK, I have access to 20 years of medical data collected in Austria. There, as a researcher, connecting my engineering skills, math, coding, and then research curiosity, I'm trying to understand what we can learn from this data. Can we extract something like medically relevant, and hopefully to be bridged between our current status and precision medicine, personalized medicine? Can we be the bridge? Can we do research projects which are helping us to make one step forward precision medicine? In projects I was working, we were developing new methods, trying to understand gender differences. What we learned is there are many gender differences. Females are still expected to fit into historically made healthcare system for males. So basically, we females, we experience lots of barriers, not even knowing. Looking at the data in Austria, we learned many of these things. Our results hopefully helping the medical professionals to treat female patients better. Furthermore, I'm really excited about opportunities in learning about aging. We are an aging population. In Austria, we are facing many challenges, we as individuals, but I believe also healthcare system. So I'm trying to understand, looking at the data, how patients aging, how they're collecting diseases. We are trying to develop new methods using AI, using network science, complexity science to build novel methods to extract disease trajectories. What I truly believe is that looking at the data collected in hospitals, we see patterns, we see critical events, combination of diseases in history of patients, which are critical events. Without data, we don't know that. Now looking at the data, we can understand that. We can then identify risk factors even decades earlier, which will then hopefully one day be implemented in a healthcare system, and it will be hopefully used by medical experts. Furthermore, I'm interested in equality. I would like to understand how migrants, I myself, I'm migrant, I moved to Austria, how they are integrated in the healthcare system. Having awesome data set, I'm able, together with my colleagues, to look at the utilization patterns, to understand how different nationalities use healthcare system. Our main findings are showing that nationalities, which are not Germans and Austrians, use healthcare system less, way less than all other nationalities, which is alarming for all decision makers, hopefully, because all these migrants, they lost a chance to do prevention on time. They come to hospital only when it's really needed, when it's so severe. That's missed chance. We could do prevention. We could save money. We could make them healthier and improve their well-being, our well-being. So I'm so happy to be in this panel because I can share my passion and passion of my colleagues, talk about questions which are making us awake at night. We are thinking a lot about these questions. However, there are many barriers, as you mentioned some of them. Data sets. When I moved to Austria, I was so excited to work with all these data sets. They are awesome. But soon I started collaborating with Karolinska Institute. I realized they should be our role models. We can improve many things. And as we already discussed, there are many silos of data locked, isolated on Austrian population, on income, labor market, family status. This data set would allow me and my colleagues to work on more exciting projects and to find way more exciting results which could contribute to the community, to the healthcare system, and to the research community in the world. Thank you so much.
Thank you, first of all, for your passion. Then when I listened to you, you reminded me that my heart is already bleeding. Because when you talk about data sets, it's not only data and data, because we have to know that you have to be able to use them, you have to prepare them, and to be able to use those various data sets and to compare them. And there's one thing that is really still incredible. We had the COVID pandemic here. We have 9 different areas in Austria, and we cannot compare those data. And even today, when we are sitting here at this panel, we don't have one COVID data set for all of Austria to be prepared for any future virus infection. So this is incredible, because you thought, okay, we didn't have it, we made a mistake, so we learned out of it, but we have now 5 years that passed and we still don't have those data. And as you said, looking from the Complexity Science Hub, did many spectacular studies, and I have to stress this here in front of the public. At the very end, as you did it, and you mentioned Karolinska, they went to Scotland, they went to Sweden to work with those data because they say we can use Austrian data. I mean, this is a shame, and this is, especially as you mentioned, to plan medicine for the future, you need the data of the country you're working in. So I think there is a lot of room to be improved. And Philip is a rare breed, if I may say so, because you are a combination of many things. You are an AI enthusiast, but you're not only a guy who talks about it, you really do it. You're running a primary PVE, a care center. You know a lot about digitalization, but you understand, and that is so important, both sides. You understand the patient side and you understand the physician side, and you try to bring them together, all of them, on a digital platform to get the best out of it.
Thank you, Freddie. Thank you. That's a big challenge. I think listening to everyone now inspired me a little bit to maybe be a little more critical on some things. But needless to say, we have a very healthy system. We're still in the top 10 here in Austria, Germany, Switzerland, especially. Scandinavia is far ahead, but we're doing quite well. What we wanted to do 8 years ago when we started our imaging AI startup is obviously the idealist, wanted to change the world, transform medicine, and to an extent, we managed to do so. It took us about 5 years of really hard work, knocking on a lot of doors, asking physicians whether they want to try it, whether they want to use it, and we got it up to about 30% use in office-based radiology settings, imaging centers, outpatient centers. Not so much in hospitals, because in an office-based setting, you have single decision stakeholder management, right? So there's an owner, you're asking if he wants it, they say yes. In a hospital, when I go to the chairwoman for radiology, she's going to tell me to go to her quality management team, her IT team, her procurement team, maybe the chief of the hospital, and maybe there's a group chief. And all of a sudden you have more than 6 people actually in the room, and everybody wants to say something about something. And implementation takes a long time. So when we look for innovation, we often like to look to the US. The US is a leader in AI, I mean all that big tech companies up in there, even in AI and imaging. And when I say AI and imaging, I mean medical products, certified products. So they're not self-learning products, they're closed boxes, they're deployed, they're certified by the FDA or the European notified bodies. They're really far from the Terminator self-learning scenario that everybody still envisions is out there. And we don't need to look to the US for that. We have beautiful, amazing companies here, great innovators. And the reason why those great innovators are not so much seen here is because of a lack of implementation possibilities. What do I mean with that? Technology readiness level is pretty much here. We have all the integrations, possibilities to the electronic patient record systems, whether that's in a hospital setting or private setting, it really doesn't matter. That works. What doesn't work is the incentivization for those companies who start to innovate here and they get a lot of money to start up, to stay here. The US is a very expensive healthcare system, so obviously you get a lot more money out of it, even if it's private. In the last 2 or 3 weeks, the US just passed a new AI Act, which allows claims, insurance claims, for software supported by artificial intelligence in medicine. We are so far away from that here, but this is now a big chance, a big opportunity to make something happen. Radiology is ready, from my perspective. Dermatology is ready. Oncology is ready. So there's a lot of spaces. Primary healthcare is not ready, I also say that, because we still have to digitize. But the fields that have super standardized imaging data, obviously, like when they started 10 years ago, 20 years ago, building all of this, they enabled the AI to be ready now. And my ask here is that the social insurances, the private insurances, they come on board and work with the frontline workers who are using AI already to start defining a vetting process, qualification process. So it's not about companies, honestly, it's about solutions there. And start going into a tracking process. How much AI is used? I say 30%. Nobody here can tell me if it's true or not, because we don't know. We don't know how much is actually used. We can do a couple of quick reviews, but nobody will really tell you, especially when it comes to like how much are we paying for it. That can be defined by us. And the first healthcare system that starts to reimburse AI, whether that's in Austria, Germany, Switzerland, doesn't matter, they will be the leader in medicine. Because it's the only chance for patients to get an equitable share of how they are being treated.
Wow, this is a final statement, ladies and gentlemen. No, I'm serious. Thank you so much. I will put that question, or that it wasn't a question, it was quite a remark, another question. I will put that Peter, later on to you, Peter. I do believe, and this is something, last week was the D-Health conference, the Austrian D-Health conference, and there is also something for me to observe, and it's still amazing me. There were about 400 attendants, which sounds quite a lot. I flip the coin around and say, this topic nowadays, how come there are only 400 attendants? I saw the Austrian Medical Association there with a small session. Where is the Austrian Medical Association putting forward this topic for all those doctors? There is also a big lack. And there was somebody in a session who was or still is a successful investor, and he started with My Sugar and other things, and at the very end he came to the following conclusion. He said, if you want to build a startup, either you start in the United States, but maybe you start in Austria, you get some money from the Wirtschaftsagentur, but then there's one thing for sure, leave Austria. And it was not cynical. And his advice came really because he said this is his experience, and he invested in about 10 different, I think you were in that session. He invested, and he's very successful. He said, this is my experience, that the whole surrounding and the context here, there's no money, there is no attitude, because you said this is where we have to go to. And I think this is also part of Europe. It's not only an Austrian problem, to be very precise. We have to rethink health. We have to rethink, and we will really lose a leading role if you do that. Now I'm flipping the microphone to you. Who of you wants to ask a question, make a comment before we go in a second round? We would like to invite you, like family. Good morning, everybody. Don't be shy. Don't be Austrian. No, sorry for that. Come on. There must be, share your experience with us, wherever you're coming from. Yes, please. Maybe you can get a mic. I give you my microphone.
Speak loudly.
Yeah, we have one. Can you just identify yourself?
Yes, my name is Stephanie. I actually work with Climate Lab, but I live in Port Albert. My husband is also a doctor out there, so this is a very important topic that's coming up for us. But I also see that, as you said, there's a lot of skepticism about AI in the public right now. Probably a lot of it's because people don't really know exactly what it is. They don't know what's coming. So what do you feel needs to be done in order to increase awareness and acceptance of AI amongst the public?
I think that's a very, very good point. I think we have an expression that is called health literacy. And health literacy includes the ability to understand topics in health, but also my health. And unfortunately, in that area, we are at the bottom in Europe. And that contributes also to the fact that the life expectancy in Austria is top compared with other European countries, and the health expectancy lags 10 years. And that is because of that. So your question, I will address that, is a very, very important one, because if we increase the health, and I would add the digital and the AI literacy in the public, that would help us to develop and process with many things. Maybe Ulrike, because you had experience from Germany and you did a lot of things, maybe you would like to give the first answer, and then maybe you will add to that.
I mean, thank you very much. This is a very important aspect from the German perspective. I mean, see what we're discussing publicly. Yeah, we're discussing all about what could get wrong. We were discussing all these ethical aspects, data security aspects, and we were given the population an impression as, oh well, if I spend my data, my health data, it will be abused, or something weird will be, will happen to me, and I cannot control it. This is the image that we draw in the public for the last 10 to 15 years, discussing about the digital health and the implementation of AI in the healthcare system. From a physician perspective, and I'm now separating the discussion about digitalizing data, that's step number one. I'm discussing about the implementation of AI really for patient service. I could see, and I'm not that optimistic as you here, I can see that it can support us sort of making the administrative process services, access to care easier, such as staff organization. But we really need more data, more research, more time to prove that the implementation of AI in diagnostics really can make an impact given the outcome of our patients. We still don't have that scientific readiness level as we would have, bringing any new drugs to the market.
Short.
Yeah, thank you. I want to add two examples how we can drive this topic from side of the ministry. I think also the patients have a right for explanation and we want to expand our data protection framework to require clinicians to disclose when and how AI influenced the care or influenced the results. We have e-medication tool in our ELGA, and there are also alerts and possibilities for the patients to see how medication can influence other medication. So there are some possibilities also for patients, and we want to establish citizen juries. The Digital Health Forum Austria wants to convene panels for citizens to review high-impact AI tools. So to participate our citizens and the population and also the patients to be part of the system and to enhance and improve health literacy on that topic, not only for the clinicians, also for our citizens.
Thank you. Peter, I would like to ask you, we have only 10 minutes left. I would like to ask you what is not all 10 minutes for you. He's a politician, isn't he? I would like to ask you, there's one thing, during COVID, there was, for example, the option that you had digital prescriptions, you went to the pharmacy and everything was there. COVID is over and I can't believe it, 2025, no more digital prescriptions. What can you do if we're talking about AI, and even that is because of which reasons? Money? I don't know why, but it makes life so much easier for patients, for doctors, for pharmacists. What can you, as the number one insurance company in Austria, bring in that we can progress with the implementation of AI in the healthcare system? You have 60 seconds.
Because the digital prescriptions are still there, so you can do it, but we can discuss them maybe later. The important topic I see is, and I saw it when you spoke about it, there is so many challenges for the healthcare system. The shortage of doctors, shortage of nurses, the cost explosion due to the demography. Also to innovation of medicine. And there is only one answer which can help us to overcome that. And I think that's what we have to discuss with the society. And there was the question, how can we shape this acceptance? I think these discussions we have to bring to the table. And I think all of us, the ministry, the insurances, but also the families and the societies, we have to discuss these topics, that this is the only answers which can help us to overcome these challenges. And therefore, we need to do our homework, and we are not good in that in the Austrian healthcare. As you said, digitalization is the first topic. We haven't digitalized our data so far, so without doing that, we cannot jump into artificial intelligence. And so I think awareness within the society, but homework in politics and in our companies.
Thank you so much. You mentioned Karolinska. You do such a great work, but you told us how difficult it's getting and that you could even do many more things. Are you able to share in 2 minutes what we could learn from Karolinska and their system? If you say, if we transfer that to Austria, we could really have a major gain?
I can do it in 60 seconds. So we all have social security number, and there are many silos of data, many databases connected to this number. However, in Austria, someone or some group of people decided to split all these data sources, and me as a researcher, I see health data and I cannot match it with the labor data. I cannot match it with the family status, income. However, in Karolinska, they can do it. Whole Swedish population is centralized in a database, and if they are interested in the questions, why migrants are so often on a sick leave, or why migrants have more mental disorders than average Swedish person, they go there and they get data. They get data on health status, income, education, family status. We in Austria, we can't do that. It's such like a paradox. They are data sets, but we cannot match them.
They're great data sets.
They are amazing data sets. So some things are not digitalized, like primary care, but there are things which are available, and we just need more brave decision makers to say, yes, it's working in Scandinavian countries, it can also work in Austria. Let's try. We can do a pilot. We don't have to do it on a whole population. We can show you what we can do, and then when people are amazed, hopefully they can give us then the whole population data.
I've seen one pilot already from your Complexity Science Hub showing if we use the data, we can predict the next 10 years in the Austrian health system, where there is a lack, where we have to focus, where we have to concentrate. That was beautiful and so convincing. It's a pity that it was only a pilot and it never turned into reality. You have now the finishing words, because I will invite you to look into the far future and give us your vision and your dream.
Wow. Let's stick to healthcare. I think that we need to listen again to the group, and it gets better the further we go down. In terms of vision, we need to stop talking about the limitations that we see in terms of data security and regulations, and start talking about solutions so that patients will understand what the benefits could be and already are. Because everybody is talking about is regulation. We have in the EU Act 3 more years of more regulation of AI. It needs more boldness. It needs more pilots. It needs more readiness to implement innovative solutions, and it starts at the top and goes all the way to the bottom. That means the private sector is already on board, so now let's get the public sector on board as well. I think we have the right people, the innovators are here. It just needs a little bit more effort on all ends, but ultimately I see a bright future for the healthcare system because these companies are still here, because we're still innovating, and yeah, I think that's the future and vision, because eventually gets better.
Thank you so much. First of all, I would like to thank all of you. As I invited you, I was so happy that all of you accepted the invitation, and I hope you share my judgment. These 5 are outstanding, and hopefully they will help us, that we have some progress, because they really want to do it, and we will convince the system. And I would like to end with one of my favorite poems by Samuel Beckett, Nobel Prize winner in literature. Ever try, ever fail, no matter. Try again, fail better. Thank you so much.